Hey, hello everyone, and welcome to yet another Tooth Talk with Your Dentist on the dental.com. I'm Dr. Rekha, and the Tooth Talk with Your Dentist is a program to create increased oral and dental health awareness among people. Do visit our website www.thedental.com to get more information about your dental health, and do subscribe to our YouTube channel to get your latest updates. And today, in conversation with me on the Tooth Talk is Dr. Ravindra Savadi. To give you a brief introduction about Dr. Savadi, Dr. Ravindra Savadi is a professor of prosthodontics and practices exclusively at Savadi Dental Care. He has just completed his tenure as the president of the Indian Prosthodontic Society. Dr. Savadi is a graduate from the VS Dental College, Bangalore, and did his post-graduation in prosthodontics from the Government Dental College, Bangalore. He has over 31 years of experience in clinical dentistry. Dr. Savadi has to his credit several publications in national and international journals. He is formerly the head of the Department of Prosthodontics at the Oxford Dental College. He has been a paper setter for both UG and PG examinations. He has been a PhD guide as certified by the Rajiv Gandhi University of Health Sciences. He has guided several PG students in the specialty of prosthodontics. He has been a UG and a PG examiner at several universities across India. He has also been an inspector for the Dental Council of India. He was the past editor-in-chief of the prestigious Journal of the Indian Prosthodontic Society. Dr. Savadi has been an active member of the Indian Dental Association for the past 30 years since his student days. He has served at the local branch, the state branch, and the national level at various capacities. He has held the post of the president of the Indian Dental Association at the Bangalore branch and the Karnataka state branch. He has been in the organizing committee of several scientific conferences as a convener, member, and chairman, and conducted several hands-on programs in prosthodontics. He has been a member of the board of the PG studies of the Rajiv Gandhi University. Dr. Savadi has been a keynote speaker and a guest speaker at several conferences all over India. He has been awarded the prestigious S. Ramachandra Oration Award by the IDA Karnataka branch in the year 2010. Dr. Savadi, sir, welcome to this To Talk with Your Dentist program. Thank you so much for being a part of this conversation.
Thank you for the nice introduction, and I am also proud to be here. I must appreciate your efforts, Dr. Rekha, in doing all this for the information of the general public. It's indeed a selfless work that you are doing.
I should thank you, sir, all of you people who have been a part of this program, all my seniors and all my colleagues for giving this kind of an unconditional support and in promoting dental health awareness among people. So thank you, sir, again.
Thank you. Thank you.
So considering you're a prosthodontist, sir, which means it's an area which relates to replacement processes, which is an artificial replacement, and prosthodontics, which is replacement of missing teeth or placing artificial teeth in the mouth. So
teeth and associated structures.
Yes, teeth and associated structures.
So
of course,
since I have been teaching, it runs like this: replacement of missing teeth and associated structures. It's kind of memorized into my mind. It is like saying A to Z. So when I just say A to and leave Z alone, it leaves it incomplete.
Yes, sir. Yes, sir. So what would you like to tell our patients, sir? The people could have a lot of what you call, I wouldn't say confusion exactly, but probably they would love to get more information to understand the replacement options that are available to them. For whatever reasons, they have got their teeth removed, and if they are considering to get their teeth replaced, what would you suggest, sir? What would be the best replacement option that would be available to them?
So, to understand what would be the best replacement, we must first get to know what are the different kinds of ways that teeth are generally missing. So, teeth can be missing, the entire set of teeth can be missing, wherein the person is completely edentulous. Edentulous meaning there are no teeth at all, something like this, where there are no teeth present in the mouth. Or it can also be a partially edentulous person who is having some teeth and not having lost all the teeth. So few teeth are present, few teeth are missing. And we generally again classify as prosthodontists into removable prosthodontics, again further subclassified into complete denture prosthodontics and partial denture prosthodontics. And then we have a fixed denture prosthodontics. And then of course there is implants and then maxillofacial prosthodontics. So maxillofacial prosthodontics, I will not go much into that field or that subject right now, other than just saying that in maxillofacial prosthodontics, we replace teeth and associated structures, which can also be involving the cheek, the nose, the eyes, it can be the mandible. So, and how do these get lost? It can be because of a cancer. And many of you would have seen on TV, there is always advertisement of cancer patient after eating tobacco. So that kind of situations wherein we give what is called as an obturator. Even the eyes are replaced. Eyes, of course, not for seeing for the person, more for beautification of that person. So this is the field of maxillofacial prosthodontics, which is quite a progressed field, and a lot of people all over the world are doing a lot of work for this, what shall I say, unfortunate patients who have lost so many important parts of their body. So coming to the basic stuff, so let me start with the complete denture prosthodontics. So there are missing teeth, all the teeth are missing, and then you give a complete denture in this particular manner. And restore the teeth. It is not as simple as this, the entire procedure. People take between a week to 10 days to do it, and you require about 4 to 5 visits for this particular process. So this is a complete denture prosthodontics. This is one way of doing it. When this is done, what one should keep in mind is it is the replacement of this teeth might look a little bit easy here, and it looks like as if the patient can just wear the denture and start walking around and talking and eating along with this. But it is not as simple as that in all situations. Textbooks say we require up to about 1 month to be able to get used to the denture, but at least a week or 10 days is what is required when a denture is made by a good clinician who's got a reasonable amount of experience. The other important thing in this complete denture is one needs to adapt himself to the new situation. Earlier, when we were having teeth, if you touch on this side, then it's got nothing to do on the other side. The same thing, I touch my front teeth, it's got nothing to do with my back teeth. But here, if I touch here, then this is going to get lifted up. If I touch here, the opposite side can get lifted up. So a little bit of unlearning and learning will be required. And this is also going to be like a foreign body.
Yes.
So in the beginning, the patient has to get used to it. The subconscious of the mind is conditioned to have, whenever there's food going inside, salivation increases to start the digestive process as the food is going inside. So that might be the same thing continuing when the dentures are put in the mouth also in the beginning. Salivation is going to increase because the subconscious presumes that this denture is like a food. So increased salivation, and then there is also going to be difficulty in speech because the tongue is free. Right now there is nothing that is there, and suddenly when the denture comes into the mouth, the tongue is kind of held inside. It's like imprisoned by the inside of the denture. So the tongue is ain't going to get stuck in this particular area. So it's going to get imprisoned in this area. So this is another thing that is going to happen. And eating also is going to be a little bit difficult in the beginning because you cannot eat on one side for the reason which I explained. You eat only on one side, it's going to get lifted up. Eat on the opposite side, it's going to get lifted up. So you have to eat on both the sides. So this is a little bit of a disadvantage with the complete dentures. Now another alternative for this, I'll just flip the is to go in for implants. When you go in for complete implants like this, then you can have a fixed way of restoring it. So this is the other alternative that can be done when there are full mouth cases required. This is called ripper. So the flipper.
So when you said, sir, that implant will be placed, so that means this kind of a denture will be resting on the implants. That is taking the support of implants.
Correct. Correct. Depending on the number of implants, it can be implant and tissue supported, or it can be completely implant supported. So if the patient does not want removable denture at all, then he or she can go for completely implant supported, or if they can just go for 2 implants with a removable denture. So in which case it is going to be both tissue supported and implant supported. In that case, the implants are going to be only two in number here on either side, and then the denture is going to be fixed to that underlying implants, and it is kind of like a clip-on. It is going to have some resistance and stays better in the mouth. So for economic purposes, this can be another good alternative. Not only economic, in certain situations, this can be a good alternative to implants. So in partially edentulous situations, partially edentulous wherein some teeth have been lost, some teeth are present, then you go for a removable partial denture. So it is looking something like this. Though in the current day, the removable partial denture is kind of reaching obscurity in the West, which is more economically well enriched. But in India, because of our socio-economic conditions, we need to go have a removable partial denture. We can't go about putting implants for all our patients. They cannot afford it as of now. So this is called as a flipper. It is also called as a gum stripper. So it is a acrylic partial denture. There are other, this acrylic is a little bit rigid. You cannot flex it. There are other materials called as Valplast, or there is a Sunflex. So these are a little bit more rigid and sit better. These are, in my opinion, only interim dentures. These are not permanent dentures. Not to be used on a permanent basis. You can use it if the person is busy, is not able to come back for some period of time, maybe 2 months, 3 months, then you can use this, not on a permanent basis. But still, people do use it, but when they don't have a choice. So the removable partial denture is another way of going about it. The next part, the fixed partial denture, wherein the similar situation, when you are giving teeth like this to replace that. So instead of this removable type, you can reduce the adjacent two teeth. So you make them small like this.
So the
You make them
teeth
small
are made
like
smaller.
this. Yes, Rekha?
The teeth are made smaller, sir. They're trimmed and they're made smaller.
Yeah, we let me say prepare the tooth to be able to receive the prosthesis. So the next type of prosthesis here, you give a fixed partial denture in this manner. So you have to prepare the teeth on either side and then fix it. The disadvantage here, though this is a treatment modality, it is an accepted treatment modality, but then over a period of time, we will realize the disadvantage here is we are unnecessarily grinding two good teeth. We're grinding this tooth and this tooth, which is intact, and then dragging this into this bridge. So putting the bridge here. So instead of that, this is going to go instead of individual teeth, this is going to become a bridge, and they're all going to become dependent on each other. If by chance there is any problem with this tooth, then we have to remove the entire bridge. Or if by chance there is any problem with this tooth, then again the entire bridge. Or if the facing or the ceramic wears out or it breaks, then everything is removed. It can also be that there is a foot allotment happening in this particular area. So these are certain disadvantages with the fixed partial denture. So to take care of this, to handle this situation, we can also leave this alone as this is. Leave this alone, not to touch either of them. You can place an implant into the bone directly. So implant goes into the bone directly. And ideally we would like to place the implant, wait for a period of about 6 to 8 weeks for a procedure called as osseointegration to happen. So osseointegration is integration of the bone into the implant. So the bone kind of grows into the implant and holds it together. So during that period, this is closed up. And then on the next phase, we place what we call as an abutment on top. So the abutment comes into position, and then we put the crown on top and restore the tooth. So this can be single unit crown, or like I showed you in the earlier here. So this can be extended to all the units here into the entire mouth. And we can do an all-on-4, we can do an all-on-6 or an all-on-8, depending upon what the clinician decides is the right way to do it. This in a nutshell, can you hear me? So this in a nutshell is how we go about restoring the teeth. The complete dentures, the removable partial denture, both of them are removable dentures, and then the fixed denture using the adjacent two teeth, and then the implants, which in my opinion, if the bone is good and if the patient is medically fit, BP and sugar under control, that will be the ideal way for restoring the teeth.
So either way, sir, according to the patient's convenience and also clinical, considering the clinical conditions of the patient has to anyway still go for any kind of replacement of his missing teeth, because once you leave a missing teeth unreplaced, it leads to other complications like further decay in the mouth and further gum infections and things like that. So at that point, whatever the patient can afford, you suggest that it is best that they go for any one kind of replacement at that
Absolutely.
point.
Absolutely. Because let us take up this scenario. Now, this tooth is not there, and you have got the tooth in the back only. So the upper teeth are going to put load only on this tooth. So chewing in the premolar is not a great amount of chewing because the surface area of the premolar is small. The surface area of the molar is bigger. The chewing happens only on this particular tooth, which can significantly weaken this tooth and spoil this. The other thing that will happen, this tooth will tend to tilt. This tooth tends to move forward, and there is malocclusion, malalignment happening. So, not at all the ideal scenario to leave the missing tooth alone. Always suggested to restore the missing tooth.
So according to the convenience of the patient, it is best to replace it. I think, sir, that was a very useful bit of information to our patients, I hope. And I think since the tooth replacement topic is so vast, so huge, and there is so much more to discuss and convey to our patients, I think hopefully I'll be able to get you back, sir, for another conversation so that you can share with all the patients, your so many years of clinical experience.
I'll be most glad to.
Thank you, sir.
It will be a privilege. Yeah.
Yes, sir. Thank you, sir. Thank you so much for joining me today, and I hope to see you soon again.
Thank you. Thank you for having me. Definitely, we will do it again.
Yes, sir. So viewers, that was Dr. Ravindra Savadi, who did give us information about the tooth replacement options for any missing teeth. I hope that was helpful. If you have any queries, do leave your questions behind in the comment sections, and we will get back to you. And don't forget to subscribe to our YouTube channel to get your latest updates. And till the next time I come back with another dentist with another topic on your dental health, keep smiling and be happy. Thank you.